High cholesterol is another one of our big four risk factors for arterial disease. And if the cholesterol is too high, it will actually diffuse into the wall of our arteries, and that's not a good thing. High cholesterol really comes from two places. We either eat it or we genetically make it, and a lot of people do both.
For years, I went for a yearly physical, I think starting in my 30s. At the time when my cholesterol was noticeably higher, my doctors, kept saying, you need to be put on some type of medication. And I just couldn't. I thought, this is too young to start taking any types of medications.
And the treatment for that really needs to be centered around going after dietary factors and treatment for that, and genetic overproduction and treatment for that. And we've got great medications for both of those.
When he got my numbers after all my blood work, my physical, Dr. Chambless told me that I really needed to bring my cholesterol down. The only way would be medication. But Dr. Chambless had decided to just start me on a very low dose and just see if that would adjust. And it did for a while, but then he had to boost it. I mean, it's just, the numbers are incredible now.
Bonnie's an amazing lady. When she first came to see me, her cholesterol was high, and I really think her prior physicians were not being aggressive enough at getting her cholesterol down. She humored me, and she let me start her on medication, and her numbers have come down, and she's got a bright future ahead of her. We have a lot of data out there that show if we get our numbers low enough, especially with the LDL cholesterol, that we can keep fat from building up in the wall of the arteries, and that's what I hope for Bonnie.
Dr. Chambless really took the time and discussed things with me that no other doctor had ever done. Everything that Dr. Chambless's staff does, I feel it just couldn't be any better.